Hi, I'm Dr Yousif Alyousif, a fertility specialist with Melbourne IVF. My background in fertility actually started a very long time ago. I took a year off medical school between year 3 and 4 to do some research. And that research happened to be in the fertility field. And that's when the spark kind of started. And I was looking at prolactin and oxytocin hormones, and I thought, this is interesting, and I want to do more of this. So I actually went to Brisbane to spend time in a fertility clinic as a medical student, and I really enjoyed my time there. And since then, I've been focused on becoming a fertility specialist, and here we are. I think the fertility field, in the grand scheme of things, when we look at other medical fields, is still quite young. And there's a lot of research happening, and especially being part of the team at Melbourne IVF, which a lot of our specialists and our scientific director are very big on research. It is fascinating that we still don't know everything about fertility, and aspects of fertility such as male infertility, we're starting to learn more about it these days. And I find that fascinating that we are at the forefront of research. We're still learning about the field. Not 2 days are the same. Every day is different. And the other aspect, of course, is dealing with patients. I love our patients. And I love the fact that it's not just a one-stop and then you don't see them again. We get to have that relationship, that personal relationship, not just with the individual, but sometimes with their whole family. And then you see them again a few years later when they come back for baby number 2 or baby number 3, and they bring on baby number 1 for you to meet. And I find that relationship with patients very, very rewarding. My professional style, I think, is not very professional. I think they will say I'm very personable, and I've had patients tell me I should have been a teacher. I actually have slides that I share with my patients, and I find my role, or I see my role as I need to empower my patients with enough information for them to make an informed choice, one way or another. With a lot of what we do, there is no one right answer. And I just need to make sure they have enough information to make a decision and be at peace with that decision. And then I can support them along the way. I think a memorable case that I can recall from recent experience is a patient who had multiple cycles and unfortunately multiple embryo transfer that did not stick. And she was close to giving up. And we had multiple discussions about continuing on and trying different things to try and maximize her chances at each step. Luckily, her last embryo stuck, and I saw her for her pregnancy scan, and that was perfect, and we saw a heartbeat. And at the end, before she left, she mentioned on passing that hadn't I not persevered and encouraged her to keep going, she would have actually stopped. So that was very rewarding to hear, and I'm very pleased that they persevered. It takes a lot of resilience to undergo fertility treatment. It's such a tough journey. So I'm always in awe to our patients for what they go through. They are a very, very resilient bunch. What some of our colleagues might not realize, fertility is more than just IVF. And one aspect that I found fascinating is actually just going back to basics and understanding the basic physiology of the day-to-day things that we do. And I find all the hormonal regulations and how different hormones talk to each other is quite fascinating. And then when you step into the IVF lab and you see how one cell, which is an egg or a sperm, 5 days later turn into this embryo, and you can watch it live with our incubators or embryoscopes, where you can condense essentially 5 days into a few seconds, and you can see how this cell divides over time. It never ceases to amaze me. I think there is so much going on in the fertility science, and we're very lucky to work with a very passionate group of individuals, from clinicians to scientists, who are always interested in different aspects of the field. And I feel lucky to be exposed to such interest. But I think one area that we are seeing a lot of changes is male infertility. And recently there's a great collaboration that's happening between scientists, embryologists, clinicians, and engineers. And one of these fields, for example, is microfluidics, which when we think about microfluidics, fertility might not be the first thing that comes into your mind. But there's a lot of research that's happening in the background, including in our own lab, in the use of microfluidics and AI in terms of how we can optimize the quality of the sperm that we get, but also when it comes to testicular biopsies, how we can use AI and computers to find sperm a lot faster than an embryologist might be able to. If the patient leaves the room feeling that they are empowered, they have enough information to make a choice, and that choice could be not pursuing treatment, then I've done my job. I do enjoy playing soccer, and at the moment I'm living my soccer dreams through my son, and sometimes that involves either coaching or being a referee for their weekend matches. But my other hobby is coffee making. I like making coffee at home. My wife tells me I steal a lot of bench space, but I also like baking. So when I bake her a cake, she's happy. One thing that's very important when it comes to fertility or any aspects of your health is information. But it is important to seek information from reliable sources through our websites, through our YouTube channel, but also there are a few other reliable sources. If you find yourself confused, because there's a lot of information out there, when you Google or read through the internet, you might get conflicting messages. We are there to support if you want to come and just have a discussion. We can clarify some of those myths and we can guide you through your journey. We're not just there to offer you treatment. We are also there to educate. So feel free to come book an appointment, have a discussion, and there's no pressure from us to undergo any treatment, but we're there to support you and provide information if needs be. I think fertility journey can be quite challenging. There's a lot of ups and downs. I normally describe it as a roller coaster of a journey, but you shouldn't feel alone. We are there to support you, but also reach out to people around you. This could be your significant others, there could be siblings, your parents, or your friends. It is difficult to go through this alone. If you don't have that external support, please reach out to us. We're more than happy to support you.